Good day, everyone. Welcome to Bonita's Maternity Program webinar. Today we'll be speaking about discomfort management during labor with Sister Susan DeVet.
Hi, everybody. Thank you for joining us for the Bonita's talk on the Maternity Program webinar, discussing your discomfort management during labor. Okay, so first of all, it's important to think about what you think your labor might be like when you go to hospital to have your baby. Every lady has a different picture in her brain on how she's thinking her labor would be. Some consider having a candlelit dinner with soft music, the delivery being gentle and calm and relaxed with a doula or a midwife. Some people are planning to have a cesarean section, a booked cesarean section. You might be planning a natural delivery in hospital. Or at this stage, some of you might not even be sure yet on how your baby will come earthside for the big day. So at this stage in your brain, it actually shouldn't matter how your baby will be born. It's important to think about how you are going to manage the possible discomfort of having this baby. Okay, so initially it's nice to look at your fear tension cycle. If you understand the fear tension cycle, you might understand the anatomy and the physiology and the whole function of labor and birth a bit better. So if you are quite scared of the whole situation, so if you're not informed and you feel a lot of stress, you might not be supported that well, now's a good time antenatally to sort out those issues before you go to have your baby. Because if you are going into labor and you feel very frightened, you have a fight or flight response. So you feel a lot of stress and anxiety. You might be tearful. It might, at the end of the day, almost be a more dramatic situation than a joyous situation. So things that you really need to think about. But in labor, if you are frightened and stressed, your muscles are very tense, your jaw, your abdomen, and your pelvic floor, all your muscles are quite stressed and stiff. And those are all bad things when you have a baby. So you want to have a nice, relaxed body, a soft pelvic floor, wide open legs, so that the oxygenation can increase to your brain and to your uterus and, of course, to your little baby. And if you are all stressed up about the whole situation, all the bad things happen. So you have decreased oxygen to your baby, you've got lactic acid forming, and then also you perceive pain and discomfort more than what it actually is. So it's quite important to break this cycle. And things that you can do is to focus on relaxing techniques. Maybe if the sounds in the hospital stress you out a lot, is to have sound blocking earphones, maybe a Bluetooth earphone that you connect to your phone that you can listen to music to, or you can have familiar smells, so taking your own pillow with you to hospital, or even if you enjoy aromatherapy, to have aromatherapy burner with you in labor ward. Just check with your labor ward if it is permitted, but normally the vaporizing ones are safe as long as there are no open fires involved. So you can have one that you plug into the wall that works quite well. Okay, so the picture in your head that you have of labor and birth, the sad thing that I see in the antenatal classes is that most moms tend to have a Hollywood birth in their brain. So they tend to have this intense situation that there's a lot of pain, a lot of screaming, a lot of people running around, and it's quite a crazy situation if you look at it. So if you ask any midwife, they're all quite depressed about the whole situation, how Hollywood implies birth to be. So in labor ward, it's nothing like that. So the picture in your brain is definitely not, might not be the correct idea that you might have. And like I just said is to break the pain fear cycle. And then, of course, if you are informed, you know what's going on, automatically you relax more. And that, of course, your antenatal class will prepare you perfectly for your birth of your baby. And that is basically covered by your Bonita's medical aid fund as antenatal as part of your benefits. So pain relief, the natural way of pain relief, is something that you can try. It's also something that you can use at home before you come into hospital, so early labor. when you are still comfortable and relaxed at home. Natural pain relief options are water, so that's lying into a warm, relaxing bath or standing in the shower. It's good ideas. And then also to do a massage that focuses on feet initially. So you can do like a reflexology massage, or you can have your partner massage your hands for you, your back, your head, your shoulders. And I tend to find that moms prefer soft, gentle touch initially. And then when they come to early or active labor, more at the end, they prefer a firmer massage or even counter pressure. So when there's a contraction seizing, then the dad would normally press hard with his hands on the back of the mom's hips. The counter pressure relieves a lot of pain. Other thing you can also try is movement. Might sound silly, but slow dancing works wonders for pain relief initially, because if you are moving, your baby comes into the right position for birth, your pelvis opens up for your baby to move, to descend easier, and also your muscles relax when they are a bit warmer. So movement is a very important thing to consider. Also, if you don't like dancing, you can do walking, you can do squatting. All of those positions help you with pain relief. Then the other thing you can think of is visualization. So labor for me is something that comes from the brain. So most moms think, oh, God, it's my body having this baby. It's actually your brain telling your body what to do. So your body will be able to have this baby, if you're awake or not awake. It's your brain that interprets everything that's going around you. So it is definitely of value to consider doing a visualization course, but I'll talk to you a little bit later about that. Okay, so yeah, hypnobirthing, that's part of your visualization strategies. And as you can see, the benefits of hypnobirthing, it helps you with discomfort during pregnancy. It reduces your anxiety and elimination of fear. It's an easier and calmer birth, and it's often without pain. It significantly decreases the birth trauma and stress to the baby. And people tend to be more informed about pregnancy and birth. They tend to benefit a lot of hypnobirthing. So basically, I think about 10 or 20 years ago, when you speak about hypnobirthing, people have this idea of a hippie having a baby in a waterfall. But at this stage, it's more a training of your brain, how to cope with the discomfort, how to visualize what you need to do, and having a very clear goal set out for you. So pain relief, definitely breathing and visualization. Keep in mind that if you are in labor and you keep on holding your breath, you have that whole fear cycle triggering as well. And also your baby gets less oxygen. So most of the time you'll have a midwife with you. So if you're in a private setting, you'll have a midwife and your gynae with you. And she will also guide you through your breathing techniques, how to manage your inhalation so that you don't become panicked, stressed, and even hyperventilate. So breathing and visualization is a very good skill to have before you go into labor. So there is hypnobirth training sessions available that are on Zoom platforms. Beautifully Born is a very nice website, and it's a lady that's accredited, and she has the most amazing hypnobirthing classes that you can attend. And then, of course, like I said, please do not underestimate the power of the brain. And my husband likes to add a female brain is actually much more impressive than a male brain. That's probably why we have the babies. Okay, so optimal birth positions. Remember, I said to you that your position that you're having your baby in greatly indicates the amount of discomfort you are feeling. So if you think about you are doing an exercise the wrong way. So if you are lifting weights behind your back, your arm is not supposed to be lifting like that. It is uncomfortable. It will become painful, and you will probably not, you won't reach the goal that you were thinking you were reaching. So having a baby in a flat on your back is definitely not the way to have a baby. So the positions on the left-hand side are all the positions that that benefits natural birth and also pain relief. So they might look quite interesting at this stage for you guys if you're not in this situation, but these positions are all beneficial for birth. So as you can see, hips always very open, hips always open in an upright position. So even if she's squatting all the way down, the mommy is in an upright position. This position works very well if your baby is in the wrong position, so facing back instead of facing front, what they call a back labor. This position helps a lot. And then also the stress on your uterus is less. So the uterus muscle fibers are made to contract inward and downward. So if you are lying on your back, your uterus actually works uphill. So it needs to contract uphill and up and not down. So muscle fibers definitely in labor work better in an upright position. And automatically, if you're doing it right, it's less uncomfortable. Okay, so also in these positions, like I said, your pelvis are open more, your contractions are more effective, the labor is always shorter, and gravity is your friend. So remember here, gravity helps you pull the baby down. So it's less stressful on your body to birth the baby. Okay. So stages of labor, I tend to find also moms that attend the antenatal classes that they tend to go all natural birth. They want to have a no pain relief situation. But it's important for me as midwife is to just inform you about other options so that you know what is available to you in case you need it. So early labor, that's when your cervix is still closed or open till 3 centimeters. The contractions are strong, but they are to a maximum of 3 contractions in 10 minutes. So the contractions are only about 30 seconds long, but they are quite far apart. So cervix being 0 to 3 centimeters, and I tend to find that moms cope very well with the natural pain relief at this stage. So that's the walking, the breathing, the dancing, the water, the sitting, the squatting, and the massaging. So these situations work very well. If you find, you know what, I can do this, I'm going to go natural birth without any pain relief, you can use those that we've just discussed right through your labor. Not a problem. But if you get to the active phase, and that's where we find that most mommies start thinking, oh, God, I don't think I can do this. This is quite stressful. I'm very uncomfortable, that they start asking for pain relief from 3 centimeters onwards. So these contractions are 45 seconds long, and they end up being to about 5 to 6 in 10 minutes. So most of you guys having private hospital deliveries are normally in hospital. And if you're not in hospital at that stage, that's normally when the mom tells you that she thinks she needs to go to hospital. So options there from the active phase is gas. It's your nitrous oxide gas. You can use an injection or you can ask for an epidural. So we'll talk about an epidural a little bit later. But gas is, depending on which hospital you are, you either get it in a container that you can drag around with you, a canister. The hospital where I work at Cat Mediclinic, we've got the nitrous oxide in the wall. So there's no chance that it will deplete or run out or anything like that. It's on tap. So gas benefit is the sedating effect or the numbing effect goes to your brain, and oxygenation goes to your baby. So none of the gas goes through to your baby, which is a nice option if you want a nice alert little baby being born. Injection is called pethidine, and what you need to remember about pethidine is it's a Schedule 7 drug, and it does cross the blood-brain barriers. So it does go to your brain. You might feel a bit sleepy, a bit disorientated, and the bad thing about pethidine is it also goes to your baby. So we cannot give this injection if you are more than 8 centimeters dilated, because then you'll have a baby who will battle to breathe when they are born. So injection only an option below, I would say safely for under 5 centimeters. And then the epidural we're going to speak about a little bit later. And then the transition phase is 8 to 10 centimeters, and that's the phase that mommies tend to really focus what they need to do. So if the mom has had no pain relief, we as midwife, we see a total shift in almost like in personality. The mom tends to focus on what she needs to do, and that is normally where the mom tells you, I don't care who sees me naked, I need to have this baby, and this is now what we're going to do. So it's a very empowering phase in labor. 8 to 10 centimeters, so you won't be able to have pethidine there. And then also something that you need to remember that is if you've got to 8 to 10 centimeters without any pain relief, you will be able to do it. So you've done the hard work. 8 to 10 centimeters would be over in about an hour to hour and a half. So for me personally, if you got to that stage, by all means, go girl, you can do it. All right, so that's something we've discussed. So the nitric oxide, the side effects is just your face feels quite cold with the oxygen. The other thing I forgot to mention is that it is delivered with a oxygen mask, but it's a delivering system for when you inhale. So if you don't need it, it doesn't give any gas. When you do inhale a nice deep breath, that is when it gives the gas. So this is for me, it's very nice to put the power back into the mom's hands. So she feels in control. She feels that she's managing her own discomfort and she's doing something to help her labor. The pethidine we discussed that the side effect crosses to the baby and that you might feel a bit nauseous and a bit disorientated, seeing that it is a Schedule 7 medication. And the epidural we're going to speak to now, but the side effects basically is you might have a tender back there where they inserted the needle. You also have the risk of developing a headache afterwards. Yeah, and that also, the epidural also doesn't cross to the baby, so it's safe for use in labor. So this is the picture of your epidural. So this one shows still the epidural needle in place. So this all gets removed. This is the little catheter, and the catheter is the piece of tubing that stays behind. So that catheter tubing gets plastered on your back, and you can then have the epidural for as long as you need it. Okay, so it's not something that can run out. It's not something that we stop. I know there's horror stories that they tell you that the anesthetist or the gynae stopped my epidural when I started pushing. The reason for that is remember your epidural pain relief takes about 45 minutes to work out of your system. So the problem is if you are totally numbed from your hips downwards, it's difficult to push a baby out if you cannot talk to your pelvic muscles. So what they normally do is, don't get a fright when they switch it off. Remember the pain relief will still be running for at least 45 minutes after they stop the infusion. The difference between your epidural and your spinal anesthetic that you have in a cesarean section. So if for instance, you have epidural running and something happens that you need to go for an emergency cesarean section, they just top up the medication. So they make your epidural a bit stronger, and then they do their cesarean section. If you've got nothing running and you're just going for a booked Caesar, then they do a spinal block. And the spinal block is exactly the same position. The needle just goes in a layer deeper, and they inject the medication, the numbing medication, take everything out, plaster on your back, and that spinal block that you feel nothing from where they've injected all the way down lasts for about an hour. So that's the difference between an epidural and a spinal anesthetic. Yeah, okay. So the other thing that you need to remember, another talk is about discomfort relief in labor, but it's also important to remember that most moms need pain relief after birth as well. So a cesarean section being abdominal surgery, you really need to consider taking your pain medication as prescribed, not to be tough. It is quite discomfort. It's like I said, it's an operation that you've had. So most moms tend to find they tend to forget to take their medication, and then your mental state might not be that good if you've got a newborn baby that you're looking after and you're also not taking your pain medication. So really consider taking what is prescribed for you. There's a reason why the doctor prescribed it for you, and take it as needed. So don't try and be strong. And then your natural delivery moms, they tend to use a lot less medication, so they tend to get away with a Panado here and there. Recovery also a lot quicker than a mom who's had a cesarean section. So they tend to recover in a week or two, they're back to normal, while your Caesar moms tend to be taking up to 6 weeks to recover for after the cesarean section. But basically, that is your pain relief for during labor. I think it's a good idea to have a sit down with your support person, being your husband or your boyfriend or your life partner or whoever is going to go with you, and discuss what do you think your needs are and what do you think your needs will be, and then also to have a discussion on how would they know that you need more and how would they be assisting or supporting you, and also what do you need to feel comfortable. Do you want to take your warm socks? Do you want to take your pillow? Should you take your earphones? And what music will you download that makes you feel calm and relaxed?
Thank you for joining our webinar.